looking at this, there's something missing. In this particular case, under the sort of payment schedule that goes on in the hospital, okay, the hospital receives payment per patient, and out of that payment, they have to take care of all patient care. So in this particular case, one of the things is the diagnosis and a choice whether somebody goes and gets a cardiac catheterization to check out their heart. So it's the imaging based upon the thallium or the PET is going to determine whether somebody actually is going to go to the next step, which is go and have the cardiac catheterization done for them based upon the diagnosis of one of these scanners. Well, the problem with that is, okay, it's not always the case that the scanner is in fact correct. And so there's two measures that come up: sensitivity and specificity. Sensitivity is the proportion of diseased patients diagnosed correctly. Specificity is the proportion of normal patients diagnosed correctly. So let's sort of look at that. So let's do the thallium first. Let's look at the thallium. So if you use the thallium scanner, what basically happens of the diseased patient, the people actually have the disease, it diagnosed 85% of them correctly, and 15% of them say that they're normal when they're not. Okay? On the other hand, if you're normal and you go in, 65% of the time the thallium is going to say you're right, but 35% of the time, even though you're normal, the thallium imager are going to indicate that you should go and get a cardiac catheterization. So this is something you didn't need you were normal, but there was no reason for you to go have it. Now, I want to say something about this. Anytime there's a procedure that somebody gets that they don't need, there's always a risk. Even though it's small, there's always a risk associated with that. Okay, so if you're normal and you have to have a cardiac catheterization, there's some risk that something could go wrong during the catheterization, which will be serious for you. Okay, so something you didn't have to do. So that's important about that. When we go down here to the PET scanner, basically it's PET scanner. If you're diseased, it basically should go get the catheterization. It was going to be correct 95% of the time, wrong 5% of the time. If you're normal, okay, it's going to be correctly identify you as normal 95% of the time, and 5% of the time it's going to wind up you're normal, but it's going to send you to go get a cardiac catheterization. So basically, the key thing here is that when you compare the thallium and PET scanner, the big difference, just in terms of cost now, is in fact that the hospital is actually going to wind up doing more cardiac catheterizations on people who are actually normal for the thallium than they would be under the normal. And those are costs, okay, that the hospital are going to incur. Those are costs that the hospital is going to incur that they didn't have to incur. So there's a marginal difference. So let's look at that, what that means in terms of numbers of different people for the two different scanners. Okay. So we'll go back here and change this around a little bit. But basically, here's what's going to happen with the thallium scanner. If you have the condition, you're diseased, okay, 85% is going to be right. 15% of the time it's going to say you're normal. On the other hand, if you're normal, 35% of the time it's going to say you're diseased, and 65% of the time it's going to say you're normal. Okay, what does that mean? Well, let's make this days, which is 240, 20 per month for 12 months. So the total number of patients is 1,920. For the thallium, what that means is, one more thing is that out of the total population, I'm going to assume that 25% are diseased and have the condition, are actually truly in condition. What does that mean? Okay, so if I have 1,920 people, so this is 1920, okay, 920, I'm going to expect, okay, that 25% of that are people, 480 actually going to have the disease, 1,440 are not. okay, just out of the total population, the average population. Well, what does that mean? Out of those then who take the thallium, it's going to identify that 408 are diseased and 72 are normal. Okay, so these are people, 72, these are people who are diseased, but they're not going to get any other, they're not going to get the catheterization because the thallium imager indicated that they were normal. On the other hand, going down here, for the thallium scanner, out of the 1,440 people that are not diseased, 936 people are going to be listed as normal. They're not going to get catheterization. However, 504 people who are normal are actually going to have a cardiac catheterization that they didn't need, all right? And that's going to be an additional cost for the hospital. Let's go down to the PET scanner. Clearly, the PET scanner is much better. I mean, it does a better job of screening, and the numbers reflect that. So we go down here and look at it, and again, we have 1,920, okay, 1,920. And 480 are diseased. That's 25% of the 1920. 1,440 are normal. Basically, it's going to diagnose, the PET scan is diagnose 456 patients as being diseased correctly, and 24 people are basically going to wind up not getting scanned, okay, who actually probably should get scanned. On the other hand, it's going to diagnose out of the 1,440, it's going to diagnose 1,368 correctly as being normal, and only 72 are going to wind up having a scan, okay, when they're normal, where it's going to be wrong. So the benefit here is clear in terms of cost, okay, which is that there's a huge reduction in people who are normal, okay, who are getting scans that they don't need, okay. And there's also another reduction here, which we're not going to quantify or necessarily quantify, is the fact that what is the cost, I'll come back to this a little bit later, is there's a whole set of people who are basically not getting scanned, who should get scanned, okay, given their condition. And that's a lot, so it's 72 with the thallium and only 24 with the PET scanner. But we're not going to assign a cost to that particular one. So how do we deal with this?